We are going to get started in one moment, everybody. Hi, everyone, and welcome back to another Connect with Hall. We're very excited to have you all here for our May webinar. We have a lot of exciting things that we are going to be talking about today and a lot of upcoming opportunities and events that you all may be able to participate in. So just another general overview of what we'll be talking about today. So we have our welcome and the overview of what Connect with Hall is, just a little reminder on why we have this segment. We're also going to have an amazing presentation from the Harris Center for Mental Health and IDD from the Mobile Crisis Outreach Team. And then you'll have a chance to do question and answers with them, along with any upcoming events and opportunities that we'll be having here at the Houston Area Urban League. And then you'll be able to ask questions as well, but feel free to drop them in the chat at any time. And then when time permits, we'll be able to ask those questions. So again, just a little overview on what Connect is. So as we know, it's a monthly webinar, which is going to break down what we are doing here at Hall for the month and the months that are coming up, as well as connecting you all with resources that are going to be in the community. So it's here to help you learn about those upcoming opportunities and make sure that you understand the eligibility and the requirements and help you identify those clear next steps on how to join them. With that being said, Connect is more than just the information session. As we know, it's a bridge to make sure that where you are now is where you want to be and allow us to help create that space to make sure that you're working towards those goals and you can become self-reliant in the process. So again, it's here to remove those barriers to information. So instead of wondering what we offer, how to access certain services in the community, this space brings all of that together to make sure that you know for the next steps. Now that we've gone through what Connect with Hall is again, I'm going to introduce our speakers today. From the Harris Center Mental Health Mobile Crisis Outreach Team, we have Larissa and Adiz here, who is going to be taking over and letting you know a little bit more about the services that they offer, how to access those, and why they are here.
Well, hi everybody. I hope everybody's doing good today. Sabrina had informed everyone, we are part of the Mobile Crisis Outreach Team with the Harris Center for Mental Health and IDD. So we're going to go ahead and start by talking about. Hold on, it's not First, we're going to go ahead and talk about what the Harris Center is. Essentially, we are community-based behavioral health and IDD services in Texas. We have several clinics all over Houston and the Harris County that focuses on helping, the diverse communities that we have in Houston and providing them with knowledge and access to mental health care that otherwise would be inaccessible. I think it's this day.
And specifically, we work in the Mobile Crisis Outreach Team department, where we are the ones who respond to any type of mental health crisis in the Harris County, from 911 calls to 98 and or on a phone number, the
crisis line,
the 713-970-7000.
And in the mobile crisis outreach team, we do have a huge team that's interdisciplinary, combined with a psychiatrist, a registered nurse, licensed clinicians that include master level clinicians that have their master's degrees, and bachelor level clinicians that have their bachelor degrees. Peer support specialists, which are the ones that have prior experience with mental health issues and struggles, alongside other struggles that may be able to give them that opportunity to connect on a personal level with clients. And we also have psychiatric technicians that are the ones that assist us with medication drop offs and also transportation to and from medication management appointments here at the Mobile Crisis Outreach Team office, but also to linkage appointments where they receive long term care.
Slide is not done.
Just to be sure, as I click to go to the next slide, is it showing up for everybody? You are muted, so I can't hear you.
Is this the correct slide? I'm going to take away the control and then put it back for you.
Yes, this is the correct slide.
Okay, so the mobile crisis outreach team, the services that we offer are crisis intervention, psychiatric assessment, nurse evaluation, substance use assessment, and case management, transportation, care coordination, and peer support. So we have a lot of different services that we offer, and we have a lot of people in a team that are able to provide those services. And when your case is assigned to one person, then the caseworker is able to determine if the person is in need for additional services. And also the clinics around the Harris County also provide all of these services that are listed here. That's a great site. And essentially, who is eligible for our services? Anyone, whether you have health insurance or not, whether you have citizenship or not. We do not check for citizenship. We do essentially don't really check for health insurance. If you do have your health insurance, that's great. We will be able to write it down, get all of that information, and we'll build your health insurance. However, if you do not have health insurance, that is perfectly okay, because we do have financial assistance program where we'll be able to, the Harris Center will be able to help cover the cost of the services that you will be receiving. And we'll talk later on about how we determine the copay for each case.
And anybody is eligible for our services, especially if you're at risk for hospitalization, if you're having a crisis in which you maybe someone or yourself are intending to hurt yourself or hurt somebody else. And you also don't have to be in an acute crisis in which you're actively going to harm yourself. But if you're having ideation, thinking about, I don't want to be here anymore, I would be better off dead, that can also give you access to our services, as our main goal is to prevent things from escalating to a higher situation. And for the MCOT referral process, it is generally very easy. Multiple people, they call the crisis line, which is the 713-970-7000 number. You call them if you're having any suicidal thoughts or homicidal thoughts, or if you're even hearing or seeing things, or for somebody else, family member or a stranger or whoever it may be. And you present the situation that's going on. And as soon as the crisis call is completed, one of our crisis teams here at the Mobile Crisis Outreach Team is notified by that, and we are immediately, sending one of our units out to go and assess the client that may be struggling with whatever situation. And then depending on whatever the assessment and evaluation, is determined, we either hospitalize if necessary, or we open to our services in which we assist with short-term stabilization until they are linked to long-term services. And you can also text or chat with the emotional crisis line, which is 988, or texting support to the 832-479-2135 number.
In terms of financial responsibilities, like I've stated earlier, we do have a financial assistance program where we will take the basic information from you and assist you with filling out the packet and take a picture of your ID and ask for proof of address. And we have a financial rep who is able to fill out the rest of the packet. And on the next slide, you will see how the state is able to determine what will be the copay based on income, monthly gross income. However, your caseworker will be able to advocate for you. Let's say that your monthly income fall, under a higher amount for copay, we will be able to advocate for you. Say, hey, this person has X amount of bills. This person is dealing with X, Y, and Z. If we are able to get this copay as close to zero as possible, and 90% of the time, we are able to get the copay to $0, and when your financial is done, that is good for a year, and you'll be able to go to any of our clinics and receive mental health services with that specific copay. So if your copay is $0, you can go to any of our clinics and receive services for $0. You also will be able to get medication at NPC, also for $0.
We do not turn anybody away. And this is the chart where you can see, based on your monthly income and family size, how much your copay would likely be. But, like Larissa said earlier, we would work with you to get that copay as close to zero as possible. If you do not have health insurance, or if you have a copay with your health insurance, we get to you as close to zero. And we also have youth peer support specialists within the mobile crisis outreach team. And this is also, we are also opening up a youth crisis outreach team with this, which is going to be specific and solely for youth. And the mobile crisis outreach team will be for adults over the age of 18. And what exactly a peer support specialist is someone who has lived experience with mental health challenges, CPS involvement, or have been in the juvenile justice system, or has a history of substance use. And the purpose is to, give that connection with the youth, and in which they can relate to somebody that wants to assist them in getting, mental health support, and figure out ways to combat whatever they're struggling with, from a personal standpoint. So if I were struggling with mental health struggles in the past, and I have overcome them by seeking services, I am able to assist a youth by relating to them and explaining I have been there before, so I completely understand where you're coming from. And qualifications for a peer support specialist is generally just a high school diploma or GED, not having been in a crisis within the past year, and also having received mental health support in the past.
And again, the peer support specialist will be able to provide advocacy, support, and encouragement. They are also able to collaborate very well with the family members, especially when they are working with youth. Not necessarily to tell exactly what happened during the session, but to give a summary and give advice to the parent. A lot of the times, parents are struggles with connecting with their youth, so having that peer specialist as like a third party to help, fix the gap in the relationship is very helpful.
And we do have many success stories with MCOT, but one that we particularly would like to inform everybody about is this 17-year-old female was referred to MCOT by a school counselor as she was expressing suicidal thoughts and ideations after experiencing, a tragedy with her friend who was shot and killed at school. Now, this is something that is incredibly difficult to deal with alongside with a sexual assault that she had experienced in the past. She was having difficulty processing not only her friend being shot, but also experiencing sexual assault. So she worked with a youth peer specialist who and a clinician who was able to help her in developing positive coping skills and developing trust with their peers and their adults around them, because the main goal was to make her feel supported, and that she can reach out for assistance whenever she felt needed. And after several months of working on her depression diagnosis and working with her psychiatrist, and not only with the youth support specialist and the clinician, she was able to get off of her depression medication for over a month and was doing well. She was even promoted at her job at Chick-fil-A and became a full-time manager. So this just goes to show that although there are many struggles and experiences that one may go through, and you're struggling to deal with those, process them, there is the assistance that you can receive in order for you to success in your future and be able to combat those depressive or anxiety or suicidal ideations that you may have been experiencing.
Okay. And lastly, we really wanted to inform you guys about the Youth Crisis Outreach Team that is coming soon, where we'll have a team specifically will be helping the youth. So anybody from 3 to 17. So it's the same process. A parent or even the youth can call the crisis line 98 or any of the other numbers, and a crisis team will come. So it'll be a bachelor level clinician and a licensed clinician who will respond to the crisis call. The goal here is to minimize hospitalization, because as we know, hospital is very scary for youth, and you don't know what you're walking into. You don't know, the experience that the youth is going to have. So if we are able to stabilize in the field and also safety plan, and also, bring in the family when we are developing a safety plan for the youth, can be very helpful. And the youth will also receive a 24-hour follow-up call. The youth will also get a caseworker and a peer support and a family partner, where which is something new that we are implementing now, is the family partner is going to be able to assist the family and educate the family about what the youth is going through, and provide resources that the family can utilize to make sure that when the youth is working with their long-term mental health providers, the family is also getting all of the resources, so that way that you can help best support the youth in the house. So it's the same phone number. The goal is to have the youth minimum 30 days on our caseload, maximum 90 days. So the youth will also be able to see a psychiatrist, and we'll be able to help assist them with linkage appointments, and you do not have to have any other documentation. So the same process when adult goes for a child.
Okay. So thank you so much for allowing us to be here and explain, the great things that we are doing here at the Mobile Crisis Outreach Team and the Harris Center as a whole. If there are any questions, we're totally open to them. We're gonna open the floor for questions.
Yeah, that was amazing. Y'all do a lot of different things there. And I'm glad that you are tapping into the youth, because as we know, the way the environment is, and mental health is going up, it's good to have a resource there for them to be able to utilize and then to know that potentially even if you are uninsured, because I know a lot of people believe, hey, I'm uninsured, I live this type of lifestyle. This is more of a luxury to deal with my mental health versus something that is necessary to continue on their goals. So I'm glad to know that you do have options and that they can utilize those resources a year after they get approved for that financial. So thank you much for that. Um, while we wait to see if any questions, I do have some that I'd like to ask you. Um, First one being, what is a misconception that people might have about crisis services that you might want to go more into?
I would say one is the now that the idea of when we come and respond to a crisis call, we are bringing the police. And that especially with people who are currently undocumented, so they are very reluctant and hesitant to even reach out for help. So when we receive the call, we the team that goes is just either us
Yeah.
this Saturday or any other two parties like in our office who we solely want to stabilize. We solely want to listen and see how we can help. We The only time that we feel like we have to escalate is if the person cannot keep themselves safe and the person is very hesitant, or we feel like we are unable to keep ourselves safe and they're not going to be able to keep ourselves safe. Then we'll have to call for assistance. But we do have this department called C.O.N.N.E.C.T, and that is an officer and a licensed mental health
clinician.
provider. So it's not just an officer who is coming in and trying to, take over the whole situation. So the officer is there as to essentially to add a form of like protection in a way. However, the licensed mental health professional provider is the one who will be, leading and making decision at the end of the day. So please do not, be afraid or, think that you have to suffer alone or think that you have to keep this to yourself because you are afraid that something bad is going to happen in terms of like legal status or even going to jail, etc. We are essentially want to stabilize, want to listen, and want to provide resources. Even when we are doing an intake, we do not ask about legal status. We don't ask about any of that. It's like, do you have an ID? You have a passport? Great. You have a Texas ID? Great. We don't ask about legal status or documents or anything like that.
And that's not only with the mobile crisis outreach team, but that's with the Harris Center
Yes.
as a whole. We do
Okay.
not look at legal status at all. And I know that's something that really makes people hesitate from asking for help.
Right. That's great to know. And then you did talk about being hesitant. So how could a family or friend support someone who is hesitant to maybe engage in those mobile crisis, or crisis
Um,
services in general?
Yeah, so for family members or friends, if they think that calling the crisis line and being there with the client is something that will make them feel more comfortable, that's more than welcome for them to happen, and if they want, if the client themselves wants their family or their friends to also be in the loop of, the information that or care that the client is receiving, we have those consent forms that they can sign in order to release information to them, just so they can feel, a stronger sense of comfortability, as, having their support system alongside with them, not just physically, but also through the background. If we end up having to hospitalize somebody, having somebody that's contacting us, a point of contact, in which they can receive more information through us, or calling the hospital in order to receive any updates on the client. But also, having the warning signs available to them in order to, understand, oh, like they're acting this way, or they're saying things like that, we can't take lightly, or they're having more depressive symptoms, they're very anxious, they're isolating more, having those warning signs as a family member or a friend is very, very, very important in order to catch something before it escalates into a, far more difficult or, um, challenging situation.
And also, we are voluntary. So we can come to you and then you say you do not want the help, and we'll try our best to, talk to you and still give you a lot of resources. We have a booklet full of different resources from different shelters around town, to food pantries, etc. However, if you do not want our services, you can discontinue our services at any point. And the consent forms that you sign, you are able to tell us if you want to have somebody as an emergency contact or not. We would prefer for you to provide us with somebody we can talk to if something were to escalate, or if you need a little bit more support. However, we're not going to force you to give us somebody, especially when you do not have anybody. So you can even put one of us, the person who is doing the assessment, as one of your emergency contact. I don't know how many people I'm their emergency contact for hospitals. It's perfectly okay to do so.
Perfect. And I know you mentioned, after they are able to access the other services that are at the Harris Centers, but how long can someone stay connected with MCOT services after like the initial crisis? Is there a timeline, or is it just as long as they want to?
So with the mobile crisis outreach team, we do have a 90-day,
Okay.
program, in which we attempt to stabilize and link them to any resources that they may need, that are, maybe they have a barrier of transportation, or they are unable to access food, etc. So once all of those resources are provided for them and they are linked to long-term mental health services, that's when we pass the torch to their long-term services providers, which is going to be the same for the youth crisis outreach team, which we have a minimum 30-day program with them, and maximum 90-day program. In which by then they have to be connected to long-term services. And the reason why we do that is because, we are a point of contact. We're kind of like a bridge for them to be, with long-term care. So we don't want people to be, incredibly attached to us because we're not going to be there forever. And with extenuating situations, we might extend the program cycle. But for the most part, it is 90 days until they are linked to long-term services. Now, with the clinics at the Harris Center, they can be there for as long as they want. That is long-term care. The only thing is your financial application will have to be renewed every year. But that's, perfectly fine because we're not requiring you to have any health insurance.
And when one person is open to MCOT services, the care coordinator goes to them. So we meet you where you at, whether you're at your house or if you're unhoused, we can meet you wherever. We have a big SUV. We can just chat in the car if you are not comfortable with having us in your home, or if you feel like, it will be more private to, talk to us outside. We can go for walks. We can do anything that's going to make you feel comfortable, because the idea is for especially if somebody hasn't never experienced mental health services before, it's for my job is to help you be comfortable to talk to somebody, a stranger, about things that are going on. And hopefully when you get linked to long-term services, you'll be already know that, okay, cool, I know exactly how to talk about how I'm feeling, and this person is going to be my long-term person, and I'm going to build a relationship with them. So we come to you wherever you are, and to offer services. And just to add to what Elise just said, and I think, like, us being short term, it is good, because coming to you and talking to you, whether it's like twice a week, 3 times a week, you get attached very quickly, right? Especially when we were talking about anything and everything. And we don't want you to be too attached, and then now you are uncomfortable because now you have to meet with your long-term therapist on Zoom, or you have to go to their office. The environment is not the same anymore. So trying to link you to long-term services, making sure that you are stable enough to be able to maintain therapy. Because at the end of the day, working on your mental health, going to therapy, that is a lifestyle, right? Whether you are meeting with a professional or talking to a friend about what's going on, that is still therapy. So yeah.
And I do have a question from the chat that says, what about offering programs to deal with boredom? Many times bad behavior, a result of not having a healthy way to express their individuality or build a skill that they fit in with their peers.
So we do have, we whenever we go and assess whatever a client needs, if the parent wants the child to be engaged in other activities, organizations outside of the school, the case manager's duty is to assist in finding those services and activities and groups that the youth can engage in, whether it be at the church or it be at a community center, in order to have them, outside of the house doing something productive, something that they enjoy. Because I know that most of the time a youth might have so much time, and that's when the gears start turning in their head, and they start thinking about, oh, let me do this, and it might be something that's risky or impulsive. So having those more healthy kind of places to go to and engage in activities with and meet new people, that can be provided by the case managers, and it'll be designated by wherever you're living, so it's easier to access.
Yeah. And also, when a caseworker is developing a treatment plan, that can be one of the goals too. To attend a community event, every once in a while, and as you are working with your case worker, that is an expectation because we talked about the goal. When I meet with you once a week, I'm like, hey, did you go to Girls Inc. meeting, or did you go to wherever the YMCA? And if the answers are no, we're gonna talk about what are the barriers. So we try to help for you guys to create a new healthy baseline before the transition.
Nice. Well, I believe that is all of the questions that we have. Do you have any closing remarks or anything? I feel like you covered pretty much everything that I was going to continue asking you both as well.
Yeah, I mean, the help is out there. I know that a lot of times, the underrepresented communities, we have, whether it be the Black community, the Hispanic community, the Asian community, all of the ethnicities and mixed races that we have here in, especially Houston, since we're such a big melting pot of just about everything. I know that there's a lot of stigma towards mental health, and our main goal is to fight that stigma, because it can be difficult to get access when you don't know that the resources are out there. So we're trying to bridge that that lack of knowledge for our community, and it's very, very rewarding because we see so many people that are struggling, and they're like, oh, like I'm crazy, or my family member is crazy, and we're like, we don't like using that term. Crazy does not exist for us. So we are here to educate and combat those stigmas, and um, you know provide the assistance that the community needs. And it doesn't matter if you have legal status, if you have insurance, we do not turn a blind eye for anybody.
And please do not hesitate to call the crisis line 988 or 713-970-7000 or 911.
Mm-hmm.
And then this will also be shared out as a presentation and a YouTube video as well, so that anyone who is on here can go back and access and make sure that they are utilizing the services that are out there for them. Well, Adise, Larissa, this was amazing. This was a lot of information. I'm so glad that you two were able to join us today. We're going to jump into talking about our events and opportunities at Hall. You are welcome to stay on, but just know I will be bumping you from panelists right now.
Thank
Thank
you so
you.
much.
Thank you both again. All right, now we are moving into our upcoming events and opportunities that we have here at the Houston Area Urban League. If you don't know, we have a variety of different programs from housing, Center for Social Justice and Education, entrepreneurship, workforce development, education, and health and wellness, where each month we have new opportunities and events that you all are able to be a part of and join in on. And that is another reason why we have this webinar, so that you really know how to access those and how to show up for yourself and for others around you and for your goals. Starting with health and wellness, we do have the Mom and Baby Mobile Health Clinic coming back, which is going to be May 13th and May 27th. And this is an important resource because it provides that accessible care directly within the community and tries to help reduce those barriers for postpartum and newborn health services or just checking up on yourself. It is available to those who are trying to prioritize their health, mom, baby, women. For the babies, they have to be newborns under 1 month, and for the women, they need to be uninsured. Um, but if you are uninsured, please know that we will be reaching out for that insurance enrollment assistance, which brings up to our next direct service through Health and Wellness, which is the health insurance enrollment assistance, which directly supports you to help you access benefits and healthcare coverage. Sometimes what keeps people from applying is they don't know how to, or there's uncertainty on how to, or it's too much of a process, which is why this is a very significant service that is offered, because it helps break down what is needed and what we have to offer in that one-to-one assistance to guide you to be able to do so. So we help provide that direct enrollment assistance with things like Medicaid, CHIP, marketplace insurance, Harris Health Program, SNAP, and other Texas benefits. So clients can walk in, but you can also call the number that is on the screen or do the online scheduling from the link. Again, you will be given it after the webinar, so you'll be able to go back and access and really follow up and kind of know as far as for the eligibility. So it is open to all ages, but clients under 18 will fall under their parents. The documentation for this does kind of differ. So, like, you might need proof of citizenship for your Texas benefits, or for marketplace and Texas residency for your Texas benefits, right? So the documentation is something that they will go over with you more once you are scheduled, so that you directly know what you need to do to be able to access those. Also through Health and Wellness, we have one of our upcoming events of Wellness Wednesdays, which are really fun because they bring that education directly into the community. This particular one is going to have guest speakers from Healthy Homes to go over the 8 principles of healthy homes, and a discussion on clinical trials from the Inside Edge Consulting Group. This is a free community event that's focused on health education and making sure you're connected to the right resources, or you know the right information when it comes to your health. And it's just a great opportunity to come out, learn something new, engage in a supportive environment, meet new people. Sometimes people just need that type of community around them where they're also focusing on their health, but also want to, network a little bit more and meet other people. So again, it's those for 18 plus, free and open to the community, and it's a great time to be a part of. Speaking of fun, we do have our community block party that is coming up. That is going to be May 16th on a Saturday from 10 a.m. to 2 p.m. There is an RSVP link, which you will get on the flyer, but you can also do RSVP registration on walk-ups. This is going to be a fun, family-friendly event where you can access resources, health screenings, and have activities for the kids as well. Because sometimes on weekends you do need stuff for the kids to do so that they're not running in and out of your home. So this will be a great event for you to be able to connect with other people and then bring the kids, but also access services that may be beneficial to you or that you can utilize later on. So this event really is about building that community while also making sure that you have those resources that are accessible in a relaxed setting. Because we know sometimes we have a bunch of different fairs or other things where it seems a little stressful to access these services, but this one is all about fun and making sure that you're still able to do that. So come on out, register, and just even if you have to pop in, it'll still be a great thing for you to be a part of. Now going on to our workforce development and training, we do have our NCCR Core, OSHA 10, and Material Handling Safety Certification cohort that is going to be coming up in June. The reason why we're putting this out now, because obviously we need to plan and make sure as far as that you know the information for orientations that come up or you understand what the structure looks like. So it technically is a 3-week course. And this one is going to be in partnership with Wesley Community Center. So it's not just a training, really, as you know, you get the NCCR core certification, the OSHA 10 certification, and that material handling safety and certification, which are all industry recognized credentials that employers are looking for, you know, entry level going into these fields if you're interested in those. This is going to be beneficial for that next step, that upskilling that you need. But on top of that, you also get that career readiness training. So there's a week of career readiness and then the 2 weeks of the NCCR and OSHA 30 training. But the career readiness, you can do resume building and interview prep, financial education, and then build soft skills like communication, professionalism. So you're not just being trained, you're being prepared to enter the workforce, which is very beneficial because you can get all the certifications that you need, but if you're not showing up the way that you need to or presenting yourself or you don't have that career readiness aspect, it may not translate the way that you want it to. So we're here to build out the whole person when it comes to reaching those employment goals. We're giving that experience of certifications, but also making sure that you are ready to show up for yourself and present yourself and these certifications in the way that you need to. So if you are interested, I definitely encourage you to scan the QR code or call one of our career coaches. He's our business coordinator, developer, Harvey Kelly. His email and number is on the screen. There is also the pre-enrollment form. It does not guarantee entry into the cohort, but this will let us know that you are interested, and then we will follow up and do the next steps to make sure that we're either getting you connected with career coaching or really knowing what your career goals and how that translate into this cohort. And we also have something similar, but it is going to be for a specific age group. That is our Project Elevate Urban Energy Jobs Program, which is going to be happening in July, and we are actively enrolling for right now. So it'll be the same thing as far as reaching out to Harvey Kelly and completing that pre-enrollment form to let us know that you are interested. Those who can attend this are those who are aged 18 to 24, who can commit to those 3 weeks of training and have an interest in things like construction, industrial, and safety-focused careers. So it's an amazing opportunity, especially in that summertime where you may have a little bit more extra time in your hands to take the time to upskill and get these certifications under your belt so that you can go into this workforce a little bit ready, a little bit more ready, because who's to say you're not already ready, right? But it just gives that extra step. Again, there is the career readiness aspect as well. So you'll get the same things that were previously discussed to make sure that you are entering that workforce the way that you want. And on a different note, we do have our Urban Tech Jobs Program 3.0, which we are enrolling for our CompTIA Tech Plus and CompTIA A Plus. This is going to be an in-person training at the Houston City College Eastside campus. There are going to be day and night classes available. So the first way to get started with this is going to be attending our orientations, which we have every Tuesday at 10 a.m. at our 5260 Griggs Road, so our Griggs location. Or if you're just not too ready yet and you want to talk a little bit more with a career coach and kind of understand what your options are when it comes to tech, or maybe you already have these and you want to see if there are other certifications that you might be able to add that are tech related, you're able to get connected with a career coach. So you would just click the link and fill out an assessment. And then from there, you can list your goals, upload your resume, and then you'll be connected to have that one-to-one conversation with career coaches to kind of know what kind of path you might want to take. And phone number, or you can just come to our orientations. And then if you're not wanting to sit in class all day, if that's not something you're able to do right now, if you are already working, or you just want to get more professional certifications under your belt and you're not too sure which area you're wanting to do, the Verizon Skills Forward is an ongoing, accessible platform to where you can pace yourself with professional certifications in areas like tech, language, education, and a lot more. Even social work is on there. For those, you do need to be aged 17 plus with an interest in upskilling and then wanting to sit down and receive those professional certifications. So this is going to be up to you to keep up with them and go back to the enrollment process. You'll be able to scan the QR code and fill out that interest form, or I already put the link on there as well for when I send it out. You'll be able to go back and click it. After you do that, then you'll receive an email for you to be able to activate your Verizon EDX link, and then you'll be able to scroll and see all of the different programs and professional certificates that you're able to receive. So this is just going to be something that you're wanting to do, something you want to add to your resume. There's a lot of great areas that are on this that you may not know you're interested in unless you see it. So feel free to look into them and see how you might want to upskill, because sometimes you don't know when you want to upskill until you actually see the opportunities that are in front of you. And then we talked a little bit about this, but we always have our ongoing career coaching. So you can get that training and support to grow and advance in your employment goals or in your career if you're already in your career, and kind of just have those conversations with career coaches to be able to plan out how you want your career to go. If you just need help understanding how to do a resume, if you need to know how to show up to a job interview or talk about yourself. What is your 30-second pitch? How are you presenting yourself? What is that professionalism that you are showing? This is a great opportunity for you to have those one-to-one conversations at no cost to you, because even a lot of times these services that are offered, they do cost a little pretty penny, but through the Houston Area Urban League, they are free and accessible to you, and it is one-to-one, so you get that career coaching. Now, to start with this, if you're able to, we would prefer, come in for orientation. That way you can learn about all of our different programs, but in more detail about what our workforce development program offers. But if you can't make it, you can do an assessment, upload your resume, list out your goals a little bit more, and then a career coach will follow up with you, or you'll be connected to a career coach to schedule a meeting with. So this is a self-referral, or a partner agency is able to send you over. You can also do walk-ins at our office at that same location if you just have general questions. But if you're wanting to get connected and learn more, there's that orientation and that assessment option for you. And then at this time, I am going to answer some questions. Let me see. I do have a question that says, is there an age limit for adults? If you can go back on to the questions and let me know what specific part that is for, then I can answer that for you. And then I have another question that states, I have a 14-year-old. Can he be trained to get ready for the workforce, or is he still too young? So for our career coaching, he is still, I believe he can still access that 16 to, I believe 14 is still in there. But usually, that 16 to 24 range, we do assist with, um, and we should be able to assist. But, you can always give us a call at our office, or you can visit in, or you can send me an email and I can follow up for you. And then for the mental health services, I don't believe there was an age limit for anyone. They did say that anyone is welcome. For children, they are going to have their own mobile crisis that's going to be happening. But for the adults, I don't believe there is a limit. If you are seeking services for mental health, then at any age, you should be able to access them. Let me see. Are there any more questions? Give a few moments. Sometimes I know it takes a little bit to be able to type. But we do have a lot of great things that are happening this month at the Houston Area Urban League and the next months that are going to be exciting, and a lot of different opportunities to help you reach that goal of financial stability and really wanting to be where it comes to employment or health or even in your entrepreneurship. A lot of different programmings that we do offer. We try and look at the whole person here at the Houston Area Urban League and make sure that we're not just meeting someone at one point, but making sure that we have different programs to where they can access different things. So at this time, if there are no other questions, just have our social media and our phone numbers on here. So when I'm saying you can give us a call, you can pop in. We have our social media, so you can also stay up to date on our programs and opportunities. And then we also do have our next Connect with Hall, which is going to be June 3rd, and that is going to be with Career Gear Houston, who is going to be bringing a lot of different resources to help how you show up confident, prepared, and ready for opportunities. So that's, if you're not understanding what Career Gear Houston are, they are a great resource. I believe they do the fittings for men for professional attire if you're looking for work, or if you just gained employment, but they also do have other different opportunities for you as well there. But yeah, thank you all for being here. I definitely look forward to seeing you all next time and hope that we can continue supporting you on your next steps forward. Feel free to stay connected with us, follow us on social media, check out our website, and come to our upcoming events. Thank you all.